When do you need a PIA amendment? A privacy impact assessment is part of a regular business process that you should go through whenever you have personally identifying health information in your healthcare practice. When you have a privacy impact assessment that has already been written, has been submitted to the Commissioner's office, and has been accepted for use, that's not the end of your journey. You need to make sure that you are updating and amending your privacy impact assessment as your practice matures and as you make changes in your practice. So today, we will review what are the common triggers for doing a privacy impact assessment amendment.
You are listening to Practice Management Nuggets podcasts. Tips to help you start, grow, and improve your healthcare practice and your career. I help you manage the pink elephant in the room. Get the show notes from our website at practicemanagementnuggets.live.
When do you need a privacy impact assessment amendment? Well, you need a PIA amendment after you have a previously accepted PIA. Now, when you have a PIA that was written more than 2 years ago, well, it's time to renew and to update this. You have a responsibility under the Health Information Act, and one of the things that you said you were going to do in your PIA, to do a periodic review of the privacy impact assessment. Now, we all know that things change over time. When you planned your original privacy impact assessments, you may have had to make some best guesses about how you thought things were going to roll out. And we know that not everything goes according to plan. So things may have changed from what you anticipated was going to happen to what actually happened. Under Section 8, Sub 3 of the Health Information Regulation in Alberta, custodians must periodically review the safeguards that they have in place to protect health information privacy. So this means that custodians need to regularly review the privacy risk mitigation plans set out in the PIAs to ensure that they continue to protect against reasonably foreseeable risks to the privacy of health information. Now, the technology changes over time. So even if you don't intentionally change anything in your practice, outside forces may have changed. So you may be at greater risk if you haven't updated your computer network system to outside threats that have changed. So perhaps risks of hacking or ransomware or malware. There may be additional risks in the technology that you're using. So if you don't stay up to date with the changes, you may be at a greater risk than if you implemented some new technology into your practice. So these are the types of things that you need to consider in your privacy impact assessment amendment as part of your regular review about the risks and the safeguards that you put into place. Now, other factors, of course, include changes in legislation. So with no further action on your part, the Health Information Act undergoes changes on a regular basis. And the most recent significant change was the amendment to the privacy breach reporting requirements. So again, even if nothing else has changed in your practice, the Health Information Act has changed, and you need to update your policies and your procedures and your training in your practice to make sure that you continue to be compliant with the legislation. So let's take a look at some other common triggers for PIA amendments. You may have some changes in your electronic medical record or EMR or your computer network system. So they may be changes in the same EMR database. Maybe you originally started off as having a locally hosted EMR. And now that your infrastructure for internet communications has improved, you've decided to change your configuration and move to an application service provider or a cloud-based data center or software as a service model. Maybe you have additional locations for your clinics, and now you're changing your database so that the database can be accessible by multiple locations. You might have changes in your computer network infrastructure. Maybe you have added wireless networking, or maybe you've changed the infrastructure for the way that you are using your office productivity systems. So many practices are moving to Office 365 for their office productivity software. And that's fine, but you need to assess the risks and put in the appropriate safeguards and mitigation strategies. And that needs to be updated in your privacy impact assessment as well. So those would be examples of triggers for your privacy impact assessment amendment. You may also have other changes. You may have changes in the participating physicians, maybe even the change in the business structure in your organization. You may have changed locations. Now, some of these changes are big and significant changes, and some are rather straightforward. So the size and scope of your PIA amendment will reflect about the type and size and scope of your changes. You might have changes in the way that you are using information within your organization or the way that you share information with other healthcare providers, networks, or systems. So if you've made a change on participating with a primary care network, or perhaps an evaluation system of your program, maybe you're doing patient panel management and you weren't doing that before. Maybe you are accessing the Community Information Integration Initiative in Alberta, or perhaps you've added some other sharing of information with other healthcare providers or other healthcare regions. So all of these sharing initiative changes triggers a privacy impact assessment amendment. You might be communicating with your patients differently. So you've added some additional technology so that you now have secure email with your patients. Or maybe you've accessed a patient portal so that patients can access information directly from the portal about their own information. Maybe you are sending text reminders or appointment reminders by SMS messaging or text messaging, or perhaps by email. Or perhaps you've added online booking. All of these are activities that have new risks to the health information that you collect, use, and disclose. They each need to be addressed with mitigation strategies and appropriate safeguards, and this is the purpose of adding the information to your PIA amendment. Now, ideally, you should be doing your amendment before you actually implement the changes. So going through the process of doing your PIA and your amendment will help you to make better business decisions about the technology that you implement, the vendors that you choose to participate with, and how you're going to communicate and train both the employees working in your organization and, in this case, how your patients interact with you about how they're going to get access to their health information. Now, sometimes our vendors and partners change as well. So Alberta Netcare portal from the Ministry of Alberta Health have changed their privacy impact assessment, and they've changed some technology. So as a trusted vendor for you to access Alberta Netcare, you need to make sure that you are also in alignment with Alberta Netcare portal. So this will require you to make some changes to your policies and procedures, some training to your staff, and these will make sure that you trigger some changes to your PIA amendment. So even if you hadn't made any other changes in your practice, and Alberta Netcare portal as an example of a vendor who has made changes, you will need to update your PIA amendment to reflect the changes for your trusted vendors. So certainly you want to work in concert with your vendors to make sure that you're working to move forward together. Now, Alberta Netcare portal has provided you with some additional resources to summarize the changes that they've made in the privacy impact assessment for Alberta Netcare portal, and you need to make sure that you've updated your policies and procedures to reflect those changes. Now, there are other projects with Alberta Healthcare, with Alberta Health, that will have an impact and will trigger a PIA amendment for you. So if you're participating with the Community Integration Initiative, as an example, with Alberta Netcare, you need to make sure that your policies and procedures for everything else that you've done in your clinic are up to date. Alberta Health, as that trusted vendor, will help you to do the PIA amendment specific for the CII initiative. But you have to make sure that the foundation that you build in your house for your PIA amendment is up to date first. So all of these are great triggers that require you to update your privacy impact assessment. Now, sometimes it's a bit of a balancing act. Do you need a new PIA, or can you just go ahead with doing an amendment? Now, sometimes it kind of depends on the size and the scope. So if you are changing your EMR system entirely, you were at vendor A and now you're moving to vendor B, well, that's probably a new PIA. If you are initiating some new projects about perhaps doing telemedicine, well, that's probably a new PIA as well. So many clinics will have more than one PIA. You'll have what I call the foundational PIA, or the first PIA that you get started with. And then as you're adding additional projects that are new and are all contained in one basket of services, you might do a new PIA that reflects just that unique basket of services. If you're making a lot of little changes in your PIA, then they probably are a PIA amendment, and that can be handled often by a longish letter. So you will inform the commissioner's office about the new participating physicians or custodians that you've included in your practice. Maybe you have a new location, so you've got 2 locations for your clinics now, but they both work remarkably the same way. They follow the same policies and procedures, they follow the same EMR database. There are just 2 of you instead of 1 of you. So that may be addressed in a PIA amendment. When you go through your changes in your organization and you identify what has changed, that will help you to identify whether or not you need a brand new PIA or an amendment. In either case, you need to make sure that you've clearly identified what the change is, what are the risks to the health information of both the patient and, of course, the business and the healthcare providers and custodians, and how are you going to mitigate those changes? Now, after your amendment is written, you're going to make sure that you have that internal acceptance within your custodians that the PIA reflects what the custodians know to be true or what they plan to have happen. In Alberta, it is mandatory for custodians to submit their PIA to the Office of the Information and Privacy Commissioner for their review and comments. The goal of the Commissioner's Office is to be able to review the preliminary results of your PIA within 45 calendar days of submitting it. Now, it may take 3 months or more from the Commissioner's Office to actually finalize that review process and to send you some questions, because they always have questions, and that you can respond to those questions. At that point, the Commissioner's Office will likely accept your privacy impact assessment. So you need to make sure that you're doing your PIA amendment with enough time to give the Commissioner's Office to review and provide some questions for clarity, and to assist you to make sure that you're implementing that new technology or the new change in a secure fashion that is also compliant with the Health Information Act. If you need to do a PIA amendment, I'm here to help you complete your PIA. Join me in the course, Protect Your Practice, Your Assets, and Your Patients with Privacy Impact Assessments. Online education and coaching from me, your practical privacy coach, to help you complete your privacy impact assessment and your PIA amendments. For more information, look at informationmanagers.ca/PIA-course.
I'm excited about this new season, and I'd so appreciate your help to spread the word with your colleagues. First, make sure that you subscribe and add a review on whatever podcast platform that you use. Next, take a screenshot of this episode that you're listening to right now and share it on your Facebook, Twitter, LinkedIn, or your preferred social media channel. Remember to tag me and I will reshare your post. When you share the show, it makes it easier for people just like you and who like what you like to find the show. Until next time, this is Jean Eaton, your practice management mentor and your practical privacy coach.